Hi, everybody. Thank you so much for joining me. If you guys are feeling that like post-lunch slump, feel free to like stretch your arms and move around for a minute. And thank you so much for joining me. Thank you for inviting me. I'm incredibly honored to be here. To reiterate what everybody's been saying today is psychedelic users in the US are growing rapidly, regardless of legal access. Right now, there are minimal legal channels for those 8 million, close to 9 million people to access psychedelics, which means the majority of that is coming from illicit channels. And so we're going to quickly go over kind of the agenda of what we're going to talk about today. I work with a lot of individuals and communities who are trying to make the best decision for them around psychedelics. And so kind of helping people discern what's the right psychedelic for them, who's the right facilitator, what's the right setting. We'll go through that, and then we'll talk about some factors where we can make psychedelic use safer, high-risk populations, potential harms, and then suggestions for improving safety. And so what we've kind of learned here is that although a client might be seeking mental health treatment or recreational experience or spiritual experience, is we don't get to choose what experience we get when we take psychedelics. And so we're finding a lot of people who are treating their mental health, treating their depression, and changing their relationship with their spirituality and changing their relationship with their family system or with like the way that they interact in the world. And so when we look at psychedelic growth, it's a combination of spiritual, psychological, medical, and behavioral. And when people are engaged in any sort of psychedelic use, you kind of see this like merging of this, like all the circles into like a Venn diagram. And sometimes you don't get to choose what the outcome's going to be. And so it's really important to make sure that when you're talking to patients that they know the risks that you might come in to go to treat your depression at a ketamine clinic and find God at the same time. And for doctors who are administering this, clinics who are administering ketamine, they need to be in multidisciplinary teams of social workers, mental health providers, spiritual counselors to be able to address and care for their patients in aftercare. And so when we look at, I kind of created this psychedelic matrix, when we look at the factors that contribute to an individual experience of expanded state, there is preparation and intention, there's which substance is right for me, what dose of this substance, whether it's a microdose, a museum dose, a clinical dose, a recreational dose, a high dose. And we're finding people going way beyond what high dose recommendations are, especially in underground psilocybin settings, upwards of 15 grams for people who have never taken psilocybin before. Is it adulterated? And thank you so much for having a testing lab and creating public safety information around it, because it is really high risk and it's one of the biggest factors in causing harm is adulterated substances. Set, are you ready for it? A lot of people are not. They don't have the support. They don't have the aftercare. They don't have the financial resources to have long-term aftercare integration support. I've heard of patients, I've worked with patients who have said, you know, I saved up to go to this clinic and I spent $3,500 on this weekend retreat, and all of a sudden it's like, well, that was all of my money and now I need weekly therapy and I don't have the resources to get that. And so really being able to talk to people about, is this the right time for you? Like what's internal, what's personal going on for you? You know, did your dog just die, or your mom just die, or are you going through a divorce, and is this really the right time for you to do this? And having the ability for clinics and facilitators to actually say no. I'm finding a lot of people who are, the more desperate you are, the higher the severity of your symptoms, the higher the risk the decision you're going to make. And so what we're finding is people who are not clinically appropriate, people who are being rejected from clinical trials, going into the underground and making really unsafe decisions. The setting, location, facilitator, participants. Is this a one-on-one session? Is this a group session? Really kind of looking at, like, is this the right thing for me? Does going to an ayahuasca ceremony feel culturally appropriative? Because it's not from your culture. I have a lot of people who have expressed concern around things like that. The Native American Church has explicitly said, we don't want non-Native American people sitting with peyote because of the risks of extinction, because peyote is being overused and overfarmed. And so are we being culturally sensitive about what setting we're doing it in? And is there enough aftercare and support? And so I like to give this kind of use model for stages of psychedelic care, right? We go through this like contemplation period, right? And we kind of see this in motivational interviewing in substance use, right? We have like pre-contemplation, contemplation, preparation, treatment, and the actual treatment session, and what does aftercare look like? And I think that giving this type of information and model to potential psychedelic clinics, to potential psychedelic users, is really beneficial for them to be able to be like, is the facilitator or clinic I'm working with actually going through this with me? Or are they just like signing me up, see you next weekend, like taking your money and running through? And so really being able to make sure that the people who are facilitating psychedelic sessions, whether that's in the underground or in a clinical setting, are actually doing proper informed consent. And I'm seeing that is incredibly lacking in the psychedelic field. I'm going to kind of move through this quickly because I know we're a little short on time. And so a note about high-risk populations, right? We're seeing people starting to explore psychedelic substances, and there are some high-risk populations that you guys need to be aware of, including treating children and minors, especially with like ketamine clinics. I've seen children who have, severe depression hit 12, 13, 14 years old and getting treated in ketamine clinics, and making sure that we're doing safety studies on whether or not this is appropriate for children. There are a lot of people that have asked about MDMA for children, especially children who are on the autism spectrum. And I think that is quite high risk, but also I've been hearing about it for a decade now in the underground. And so making sure, and that is, as a social worker, that's reportable because it's mandated reporting and considered child abuse and things like that, but also it's happening and we need to be aware of it. And so what are the risks of consent and parental permission needed? Trauma survivors, what we're seeing is if you have complex trauma, or if you have a high ACE score, adverse childhood events, that the study design of the MDMA clinical trial, like every 4 weeks might be too much for you. And once it's out of clinical trials and care providers have more flexibility to be able to do long-term treatment. But a lot of these models are not long-term treatment. They're like, let's do a single thing and kind of look at this, how do we provide long-term care and also provide these like kind of one-off or ongoing every 6-month psychedelic sessions and then long-term integration. But what we're seeing, especially in ketamine clinics, is kind of this like turn and burn of we don't actually want to do the long-term care, which is why those clinics need to be partnered with psychotherapists, integration specialists, and like other people who are really willing to do the long-term care, peer support, community building. The facilitator. It's really hard to choose your facilitator in the psychedelic underground because there's no like database or reporting or consequences. If you have a mental health license, you can get reported and get your license taken away. But for all of these people that are operating in the underground, there's no ramifications. And I work with a whole bunch of survivors who have been harmed, and they said, is there anything that I can do to stop this person from harming people in the future? And I have seen facilitators move states, move countries, name changes, rechange their website, just like we're seeing in these like charlatan, snake oil salesmen areas of psychedelia. And so making sure that you and all of your friends and your kids and your aunts and uncles are making really good decisions around whether or not this is the right time for them. And then contraindicated medications, are you on any other medications? Are you on medications that might, amplify the effects, increase heart rate, dull the psychedelic effects, because there's some SSRI psychedelic interactions where the psychedelics just don't work. And so are we titrating patients off of their medication? Are they working with their psychiatrist and primary care person to titrate off their medication, or do they read this somewhere on the internet and just stop taking their meds in a really unsafe way? So I know we just kind of touched on this, like psychedelic addiction, psychedelic substance use disorder. I thought that the data was really interesting around mice and the use of that, but the reality is there's psychedelic tolerance. And high psychedelic tolerance over habitual use, specifically with LSD. Like if you take LSD today and then you take the same amount of LSD tomorrow, it doesn't work as much. So we see people who go on these multi-day binges where by the end of it, they're taking 6, 7, 10 times the dose of LSD. But it takes somewhere between 14 to 21 days for the reset to happen. And so what we're seeing is not an individual single substance use disorder, but what we're seeing is polysubstance psychedelic use disorder, where people are, and it's like, I'll take LSD this weekend, and then MDMA the next weekend, and then mushrooms the next weekend, and then I'll add some cannabis and alcohol and nitrous and ketamine on top of it. And then we're finding people in these really dysregulated states. And so knowing that psychedelics will not present in the same way that something like methamphetamine or cocaine substance use disorder presents is really important for emergency room doctors and first responders and substance use treatment facilities to know. So Jules Evans and the Psychedelic Challenging Experiences program did a survey of about 108 people who reported challenging experiences. And so this isn't like, oh, I had like neutral or good, this is only challenging experiences data. 7% of them reported an increase in suicidality. A third of them reported sustained difficulties past 12 months. And almost 40% of them reported that it was the top 5 most difficult experiences of their life. And so even in the best case, even when all the guardrails are on and the support is there and everything else, like we're still gonna see a small percentage of the population have a really hard time, and then a third of those people will have long-lasting, over a year difficulties. And so what are we doing? What are the clinics doing, SAMHSA doing to be able to like help build the mental health infrastructure that really needs to be there to address what we know is going to happen? Because it's not going to be perfect. We're humans, like it's never going to be. And so what are we doing to make sure that even that small subsection is taken care of and seen? Here are some of the adverse reactions and challenging experiences report that we saw in this study. High levels of emotional dysregulation, Perceptual changes, including 58% had self-perception changes. They all of a sudden saw themselves, their role in the world, their role in their family system to change. And so that's really important for clinics to know that this is a risk that somebody is going to have an identity crisis. And then ideally reach out to the clinic to be like, I'm having an identity crisis. And the medical doctors are like, great, we don't treat that. Like, go find a therapist. And like, that's oftentimes like impossible. And so building referral systems, working in multidisciplinary teams, those are the things that are really going to help affect positive outcome, optimal outcome. And then spiritual difficulties, 26% reported that they had a change in spiritual beliefs. It's like 1 out of 4 of the people that are coming through these clinics that are having challenging experiences also need some sort of spiritual counseling. And so here are kind of the types of harm and abuse in the client experience, in the user experience. Injuries, accidents, things that are physical, like increased heart rates, long-lasting visual or auditory perception like HPPD, psychological perception, emotional, and cognitive, the way that you see yourself in the world, spiritual harm, and this is incredibly complex when it comes to like delusions and magical thinking and thinking that like now that we've taken psychedelics, we're going to change the world together and everything's going to be rainbows and unicorns and puppies, and like that's just not how it is. And the heartbreak that comes from that, the like trusting that this is going to make the world a better place and then realizing that like the world is not a better place and there's a lot of work that we need to do can be really disheartening. And then, you know, any sort of behavioral interpersonal harms that can come out of this. Types of psychedelic harm and abuse from facilitators. So poor facilitation. One of the questions, and I've talked about this with the Rocky Mountain people before, is like, is the ketamine clinic asking, would you prefer a male or a female nurse to administer, especially for women who have previous sexual trauma? To be in an altered state and have a male nurse come into that room can cause completely undue harm. And so are the clinics actually set up to provide optimal care models for their patients, or are they profit-driven? External stimuli, facilitator error. I've seen a lot of facilitators who are very rigid of like, this is the method that I learned, and they don't have the flexibility to work with all of the different things that might come up in psychedelic spaces. Blurred boundaries, dual relationships. I see a lot of undue like manipulation and coercion of, oh, like let's start a clinic together. Like, and it's like, no, don't turn your patients into investors. Like, as licensed mental health providers, like, no. But in the coaching model, in the like kind of underground space, like this is standard practice. Is let's find somebody who is a whale and get them on our team. And I think that that can be so dangerous and harmful to people. And so what are we going to do as the psychedelic industry emerges to make sure that we can protect people around this kind of manipulation, coercion, and then non-consensual touch, physical assault, sexual abuse? Unfortunately, that does happen in a small amount of the population, but it still does happen in these clinics. So addressing facilitator misconduct. Here, there's issues with training. There's a lack of personal experience. There's a lot of psychedelic theory and not a lot of experiential training, because we're not allowed to do experiential training because of the restrictions on it. And so we're getting a lot of facilitators who are rah, excited to be out there, and then finding themselves not gaining the personal, like lived experiential experience to be a facilitator, and then going into the underground and getting harmed. Professional repercussions, I touched on that. Working in isolation, multidisciplinary teams. This is doctors, nurses, social workers, care providers, ethical marketing companies. Like, all of this needs to be together to be able to create the support system that we need for this. And then power dynamics, just being aware of the fact that if you are a facilitator, you are taking a patient into a vulnerable state in the same way that anesthesiologists or pediatricians are. And we need training to protect patients in vulnerable spaces. The facilitators need to be trained to know how incredibly vulnerable some of these high-dose psychedelic spaces are. And so really emphasizing the power dynamics and emphasizing this breaking of these kind of dual relationships when it comes to clinics. And you get patients that are like, I want to support you. What can I do to support you? And it can be really tempting when you have $100,000 worth of student loans to have somebody say, I'm going to help you advance your career. But you can't do that with the patients that you're actually treating. And so I think I have like 2 more slides, and I will take questions. So here are my suggestions for improving safety. Creating reporting systems, like an anonymized feedback system. Please, if anybody wants to develop that, I will be happy to work on that project with you. Having quarterly and annual reviews, having all of these measures that Rocky Mountain's putting out, this post-market surveillance. Consumer education, SAMHSA, this is where you guys come in, is making sure that we're putting out like all the safety flags, all the data that we can possibly put, all the information that we can put out, and what we learned in this morning session around where people are getting their information. And the government's, somewhere around Snapchat level, but you can see that 30% are getting it from teachers and parents. That means we need Department of Education, teachers, and school nurses and coaches to be able to come in and say, oh, these kids are asking me about drugs and I don't even know where to get the information. We need to partner with all of those systems, county systems, first responders, so they can get educated, so we can then give the information to the kids that are going to them if young people are not getting information directly from the government. Consultation teams. I don't like when husbands and wives and partners facilitate together, because if one person messes up, the other person will cover for them instead of protecting the patient. I know that there are great husband and wife teams out there, and if they choose to work together, I would love to see them work in larger teams where everybody is interchangeable, where you're not isolated and it's just the 2 of you working on a project together forever. That bring in other facilitators, bring in mentors, bring in people like mentees who want to work in that model. And then harm reduction, drug testing, decrim, rescheduling, all of those things will make things safer. And then last week, the Swiss psychedelic side effects inventory just came out. And it is a 32 question, 32 side effects that rate a whole bunch of things, and they go through, sorry, this is gonna be really quick. They go through a physical assessment, a cognitive and emotional assessment, and a perception assessment. And so please look up. It just got published in the Journal of Affective Disorders a week ago. And so I think it's one of the most comprehensive side effects inventory when it comes to psychedelics. And if I have any time left, I don't know if I do, 3 minutes. If there's any questions, I'm happy to take them, happy to talk to you all during the break.